Hey there, and welcome. Today, we are going to dive into a really crucial concept for understanding how your heart works. It's called afterload. And as we'll see, it's basically a battle your heart has to fight with every single beat it takes. Let's jump right in.
So I want you to really think about this for a second. Every time your heart squeezes to pump blood out into your body, it's not pushing into some kind of empty void. No, it's pushing against a force that's already there. So what is that force? Figuring this out is absolutely key.
All right, to really get a handle on this, let's use a super simple analogy, a high-pressure garden hose. You know the kind, it's already full of water, maybe the nozzle's closed. Just hold that image in your mind. It's going to be our guide for the next few minutes.
This really hits the nail on the head, doesn't it? One source described the heart's work perfectly, saying it's like trying to squeeze fluid through a narrow, high-pressure hose. I mean, you can almost feel that strain just from the words, right? That effort, that pushback. That's exactly what we're talking about.
Well, that feeling, that resistance, it's got a name. It's called afterload. The official definition is it's the resistance the heart must overcome to push blood out during systole. And systole, that's just the fancy word for when the heart muscle contracts. So that squeeze against the high-pressure hose, yeah, that's afterload, plain and simple.
Okay, so if the heart is always pushing against this resistance, what actually controls it? What makes it go up or down? Let's stick with our hose analogy. Imagine there are a few adjustable knobs on it that can make the heart's job way easier or a whole lot harder. So, what are these knobs?
Turns out, there are three main knobs we really need to pay attention to. First, we've got something called systemic vascular resistance, or just SVR. Second is something we all know, arterial blood pressure. And third is the physical shape of a really important doorway out of the heart, the aortic valve.
All right, first up, SVR. The easiest way to think about this is as the overall tightness of all the blood vessels in your entire body. If those vessels clamp down and get narrower, the total resistance just shoots up. Think about it. It's just like pinching the end of that garden hose. All of a sudden, it gets way harder to push any water through. That's a spike in afterload.
Okay, knob number 2, blood pressure. Now this one is pretty easy to wrap your head around. Just picture this. That hose is already jam-packed with water at a super high pressure. To get any new water into it, you have to squeeze with a force that's even greater than the pressure that's already in there, right? So high blood pressure basically acts like a wall that the heart has to punch through, beat after beat after beat.
And finally, our third knob is all about mechanics. We're talking about the aortic valve. This valve is the main exit door from the heart's big pumping chamber. Now, what if that door gets stiff or rusty and doesn't open all the way? That's a condition called aortic stenosis. It's basically like trying to blast that water through a nozzle that's all gunked up and narrowed. This physical blockage just massively cranks up the heart's workload, and, you guessed it, the afterload. All right, so that's the theory. We've got the hose, we've got the knobs, but what does this all mean when it actually matters? You know, in the real world, let's take a look at how this whole idea of afterload is a huge deal in the clinic. So, let's ask the question, when does this whole battle inside the chest become absolutely critical for doctors and patients? When does trying to manage afterload become, well, a matter of life and death? So here we have it, side by side, the two extremes. On one side, you've got increased afterload. That's our narrow, high-pressure hose. The heart is really straining. On the other side, you have decreased afterload. Here, the hose is wide open, low pressure. It's a much easier job for the heart. Okay, let's connect this to some actual medical conditions. Afterload gets cranked up, making the heart work way harder in really common situations like high blood pressure or with that narrowed aortic valve we talked about. Now, on the flip side, afterload decreases in states like distributive shock, which you might see in something like severe sepsis. In that case, the blood vessels get super wide and floppy. The pressure just bottoms out. And while it sounds like the heart's job is easier, it's actually a huge problem because the body isn't getting enough circulation. Doctors will also sometimes give medications called vasodilators to purposefully open up the vessels and lower the afterload to give an overworked heart a break.
Whew, okay, we have covered a ton of ground here, from a garden hose all the way to sepsis. But if you're going to walk away from this remembering just one single sentence to lock it all in, what should that sentence be?
This is it, your go-to one-sentence summary, the kind of thing you'd want to have in your back pocket for an exam. Afterload is the resistance the heart must push against. It's increased in hypertension and stenosis and decreased in distributive shock. If you've got that down, you have truly nailed the core concept of this whole explainer.
And you know, all of this leads to one final, pretty amazing question. We've just talked about this constant, intense battle the heart is facing, so it makes you wonder, how in the world does the body manage to balance this pressure, second by second, every single day, to keep us all going? But that's a whole other story. Thanks so much for joining me.